Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafide, and welcome back. If you're just tuning in, we are talking about sneezing and sinuses. And joining me now is ExpressCare's Dr. Jitka Lom, who is ready to answer our viewers' questions. Okay, Doc.
Sure.
Our first viewer's question is quite a mouthful. So bear with me, please.
Okay.
What is autosomal dominant compelling helio-ophthalmic outburst syndrome, or in other words, ACHOO?
Wow, bravo. Okay, so ACHOO, that's the sound that we make. And then scientists came up with this acronym, the ACHOO. Okay, it stands for a genetically inherited trait. About 15% of the population has this genetic trait where if you're exposed to bright sunlight, you're going to sneeze more than once. Okay, and this is important for people who, for example, are fighter pilots or drivers, that kind of thing, and suddenly they get a bright light and they're going to start sneezing. Of course, when you sneeze, you cannot sneeze with your eyes open, so you're going to close your eyes. If you're a fighter pilot, that's a problem, or if you are driving a fast car. So some people, when they're exposed to bright light, will sneeze.
Okay, now sneezing with your eyes open, as I mentioned earlier, my son asked me the same question. Mom, why can't we sneeze with our eyes open? It's impossible, right? I'm like,
it's a reflex, and again, it's to do with the cranial nerves. One triggers off the other one. You must close your eyes when you're sneezing, and I think the reason for that is because when you're expelling all that stuff, your pollen and your bacteria and your viruses and your particles, you don't want them coming back in your eyes.
Oh, okay. It's not to keep your eyes held in.
No, you cannot blow out. That's two myths. You cannot blow out your eyeballs by sneezing, and you also will not blow out brain cells by suppressing your sneeze. You know, people say, oh, never hold in your sneeze because you'll break your brain or something.
I'm not a quiet sneezer. When I go achoo, I really do go achoo.
That's okay.
So our next viewer is asking, if you feel a sneeze coming on, are there any scientifically proven ways to stop it?
Well, that's a good question. Yeah, sometimes it's not convenient to sneeze, or if you're around an elderly or sick person, you don't want to sneeze on them. So you can actually suppress your sneeze by consciously breathing out through your nose, like that, or pressing hard right here, or sometimes touching the tip of your nose will make you stop.
Oh yeah, for me, it's strange, but somebody says, bless you, before I'm going to sneeze, then I'm like, oh, okay, thank you.
And it'll stop.
It'll stop.
Very good.
No, that's something in my own mind, I guess.
That's good.
Now, our next viewer is asking, is it possible to sneeze with your eyes open? And we covered that.
We did, yeah. You actually can't. You can keep trying, but I don't think you can do it.
So for all the kids out there, no matter how hard you try to sneeze with your eyes open, it will not happen, unfortunately. Now, our next viewer is asking, I was recently diagnosed with ethmoid sinus disease. Is this common? And first of all, what is this?
What is it? Okay, so we're talking about the different sinuses that we have. So we have our maxillary sinuses, we have our sphenoid sinuses, and we have our ethmoid. They're right here, right between your eyes. There's little tiny bubbles of air in your bone right here, and those are the ethmoid sinuses. And if they get congested, full of mucus, you're going to start having watery eyes, a lot of pressure behind the eyes, and some pain in your actual nose. And again, this is treated with decongestants, sometimes antibiotics, but occasionally people do actually need surgery to clean out their sinuses, and then you would see an ear, nose, and throat specialist.
Wow.
Yeah.
I'm just thinking of a nose surgery.
Really uncomfortable.
Yeah. But now, earlier you mentioned neti pot. Now, our next viewer is asking what that is.
Okay, a neti pot looks like a little teapot. It's got a little spout, and you fill it with saline. Warm saline is best, or just water with some salt in it. And you tip your head and pour that liquid into one side of your nostril, and you can kind of inhale it, and it will travel around to the other side, and you basically flush out your nasal passages that way. If you're very skilled at it, you may get all the way into the sinuses. Usually not. It's just to clean the nasal passages.
Now, this is the first time I've heard of this. So where can you get it? Do you need a prescription or anything
No,
like this?
That's great. You can purchase it in most pharmacies and online also. It's not usually very expensive, and it is a very effective way of cleaning the sinuses. You'd be amazed at the goo that comes out when you do that.
All right. Is that similar to the saline nose drops?
Yeah, it is, but it comes in a little pot. You have a bigger volume.
Okay. Now, our next viewer is asking, is there a way to tell the difference between a sinus headache and a migraine?
Right, and that's an excellent question. So some sinus headaches will cause a migraine, you know, but sinus headache typically, people will feel a lot of pressure here, okay, in these frontal, that's another group of sinuses, the frontal sinuses here. They might feel, mostly it's a pressure feeling, okay, where a migraine will tend to give you a one-sided headache that is a pounding, throbbing headache. They can be a little bit similar. People start to notice a pattern. Migraines tend to also be associated with feeling of flashing lights, not being able to tolerate any loud noises, and also significant nausea, meaning vomiting and so on. So people with migraine headaches tend to get better when they lie down and have a rest. There are medicines that can help you. But for people with sinus headaches, you just have a lot of pressure. Work on decongesting and avoiding your allergy triggers.
Okay. Now, our last question is, what are some of the ways to soothe sinus pain?
Sinus pain. Sometimes you can do massage on these areas of your face that are very painful. You can apply heat. Why heat? When you apply heat, you're improving the circulation to the area, and that tends to help sinus pain. You can also help yourself with decongestants, again, something like Sudafed or Benadryl. And there's a pressure technique that you can use also with your tongue to push on the top of your soft palate, push your tongue right up against the top of your mouth and press a little bit here. And doing that over and over again 20 times or so will start to create some sinus relief and relieve some of the mucus that you have in there.
Wow, interesting. Thank you so much.
You're welcome.
Now, is there anything else you'd like to share with our viewers?
Just as far as sinuses, here on Guam, people can develop a sinus cancer. That tends to happen if you smoke, so make sure you don't smoke if you have sinus trouble.
All right. Now, if there is a health question or a